I want to say at the top that I have a tremendous love for this institution, and a lot of that's born from the people that are here, from the pages I get to know in every class to the folks that work the doors, the clerks, the parliamentarians. This is a special place, and a lot of the people who are known here are not the ones that really keep this place functioning. I come in here days and I have good moods or bad moods, but always find myself lifted when I walk onto this floor. It's a sacred civic space. It is extraordinary, and I'm always aware of the weight of history when I walk in here, no matter good day, bad day, whether I'm in a rush or not. When I touch the Senate floor, I feel something really magnificent. I'm going to rise tonight, as I said, and stay for as long as I physically can, and I'm going to go through issue area after issue area after issue area and talk specifically to the concerns, to the fears, to the actions taken, to the hurts that are already being felt throughout America, elevating others' voices who don't have the privilege of standing in this body, honoring those Americans who, even though they don't have such a position, they are raising their voice. I will rise for as long as I can to honor them and raise mine. The first area I want to talk about is Medicaid, Medicare, and healthcare, as my constituents spoke to. I don't need to tell anyone the importance of healthcare to humanity. Without our health, we would not be able to do anything else. We would not be able to provide for our families, spend time with our loved ones, do all of the things that make life worth living. That's why I'm going to stand here and explain to people what's going on and how our healthcare programs are at risk and being undermined. The Trump administration and Republicans in Congress are right now discussing how to cut these programs in a way of putting those savings either into tax cuts for the rich. I say either because they're going to be putting in the tax cuts for the rich, but those tax cuts, as we know, are still going to blow massive trillion-dollar holes in our deficits. They are trying to gut Medicaid and Medicare programs on which nearly a third of our country rely, all to pay for those tax cuts to billionaires and corporations. They're also dismantling the very institutions meant to safeguard our nation's health and well-being. And this is not the first time. They tried this before during Trump's first administration when he unsuccessfully tried to repeal the Affordable Care Act and cut Medicaid despite its popularity across the nation, across the political aisle. He was going after something that wasn't left or right, that Americans were saying in a chorus of conviction that this is about right or wrong. It is wrong to take away health care from millions of people. It's an unholy choice. Cutting Medicare doesn't make us stronger. It will weaken our economy. It will raise healthcare costs for everyone and push millions of Americans into crises that will ripple and radiate through their lives, their families' lives, their work lives. Hospitals will pass unpaid bills onto insured patients. Healthcare premiums will rise. People will delay care, omit medications, and then show up in emergency rooms later more sick and therefore more expensive to treat. And in the end, who pays for it? Who pays for this moral failure, this financial failure? Who pays for it? We do. The American people. And who gets rich on this? Well, I know the last tax cut that they want to extend, the people who will make the most money off of this system and this cuts because of the tax cuts they will get will be billionaires and working families in America. People who paying insurance rates hurts, is hard, is difficult. People who have high premiums and co-pays. It's the rest of us that pay. As someone who has had a front row seat watching two people I love suffer from a neuromuscular condition, and as a human being who believes in the right to access medical care, I implore our representatives and the Trump administration to consider the devastating impact that these cuts would have on people like my brothers. Slashing funds for an already underfunded program is not only the wrong target in the name of, quote, efficiency, but also a decision that would cement our nation's treacherous path toward becoming a nation that does not seek justice for all. Instead, a nation that only serves those in power, only serves the powerful, only serves the wealthy. As your constituent affected by neuromuscular disease, I am concerned about the potential unintended consequences of the efforts to so-called reform Medicaid, the thing that is so significant. Already, governors and mayors are writing letters and speaking up. When I go to different cities in New Jersey, I'm often called by local leaders because they know, number one, the stories of the people who rely on Medicaid, the seniors, the children, the disabled families, but more importantly than that, they know their hospitals who already have very fragile budgets to carve out millions and millions of dollars, as I told, over tens of millions of dollars for our level 1 trauma hospital in New Jersey. That would devastate the entire economic model for our hospital. It would affect jobs, it would affect the economy, it would affect small businesses, it would be devastating. Medicaid cuts should be off the table. It is up to these lawmakers to follow through and ensure spending cuts don't come at the expense of care for over 70 million Americans, including kids, seniors, and hardworking families. I love the appeal in that letter because it was an appeal that I'm reminded of that my colleagues Lisa Murkowski and the great John McCain and an extraordinary friend, Susan Collins, when they voted to save the Affordable Care Act, they listened to the appeal of people like this gentleman. I had the privilege of becoming close to John McCain. I came here in the Senate and got this admonition almost from Bill Bradley, somebody who held my seat beforehand, and he challenged me to go and have lunch with or meetings with all my Republican colleagues at the time. That was way back in 2013. And I was told by John McCain's staff that I had like 10, 15 minutes, but I was gonna take it. This is John McCain, he's a legend, and I go in and I meet with him, and I didn't come out of that office for about 90 minutes. And we both got emotional as he showed me pictures and documentation from his time as a prisoner of war. In 2017, he was under extraordinary pressure in this healthcare crisis, and there were thousands of Americans descending on our Capitol. I'll never forget the little lobbyists, they called themselves, kids in wheelchairs, that would roll up to Congress people and raise their little voice respectfully and ask them not to take away their health coverage. I remember people coming in here with pre-existing conditions and say, don't repeal my health care, and not even have a plan to replace it. President Trump was asked about health care when he was candidate Trump for this office, and he said he had, I think it was conceptions of a plan. And since he's been in office, I haven't heard a vision for health care besides budget proposals that would cut people's health care. But John McCain, I will never, ever forget that moment. I was actually standing on the Republican side, if I remember correctly, having conversations, and he came to the floor after listening to Arizonans tell stories like the ones I've been reading and put his thumb down. He wrote a speech about his decision, and I want to read a part of that now. I have been a member of the United States Senate for 30 years. I had another long, if not as long, career before I arrived here. Another profession that was profoundly rewarding and in which I had experiences and friendships that I revere. But make no mistake, my service here is the most important job I have had in my life. And I'm so grateful to the people of Arizona for the privilege, for the honor of serving here and the opportunities it gives me to play a small role in the history of the country I love. I've known and admired men and women in the Senate who played much more than a small role in history. True statesmen, giants of American politics. They came from both parties and various backgrounds. Their ambitions were frequently in conflict. They had different views on the issues of the day. And they often had very serious disagreements about how to best serve the national interest. But they knew that however sharp and heartfelt their disputes, however keen their ambitions, they had an obligation to work collaboratively to ensure the Senate discharged its constitutional responsibilities effectively. Our responsibilities are important, vitally important, to the continued success of our republic. And our arcane rules and customs are deliberately intended to require broad cooperation to function well at all. The most revered members of this institution accepted the necessity of compromise in order to make incremental progress on solving America's problems and to defend her from her adversaries. That principled mindset and the service of our predecessors who possessed it come to mind when I hear the Senate referred to as the world's most deliberative body. I'm not sure we can claim that distinction with a straight face today. I'm sure it wasn't always deserved in the previous eras either, but I'm sure there have been times when it was, and I was privileged to witness some of those occasions. Our deliberations today, not just our debates, but the exercise of all of our responsibilities, authorizing government policies, appropriating the funds to implement them, exercising our advice and consent role are often lively and interesting. They can be sincere and principled, but they are more partisan, more tribal, more of the time than any other time I remember. Our deliberations can still be important and useful, but I think we'd all agree they haven't been overburdened by greatness lately. And right now, they aren't producing much for the American people. Both sides have let it happen. Let's leave the history of who shot first to historians. I suspect they'll find we all conspired in our decline, either by deliberate actions or neglect. We've all played some role in it. Certainly I have. Sometimes I've let my passion rule my reason. Sometimes I made it harder to find common ground because of something harsh I said to a colleague. Sometimes I wanted to win more for the sake of winning than to achieve a contested policy. Incremental progress, compromises that each side criticize but also accept, just plain muddling through to chip away at problems and keep our enemies from doing their worst isn't glamorous or exciting. It doesn't feel like a political triumph, but it's usually the most we can accept from our system of government. Operating in a country as diverse and quarrelsome and free as ours. Considering the injustice and cruelties inflicted by autocratic governments and how contemptible human nature can be, the problem solving our system does make possible, the fitful progress it produces, and the liberty and justice it preserves is a magnificent achievement. Our system doesn't depend on our nobility. It accounts for our imperfections and gives an order to our individual strivings that has helped make ours the most powerful and prosperous society on earth. It is our responsibility to preserve that, even when it requires us to do something less satisfying than winning, even when we must give a little to get a little, even when our efforts manage just 3 yards in a cloud of dust, while critics on both sides denounce us for timidity, for our failure to triumph. I hope we can again rely on humility, on our need to cooperate, on our dependence on each other to learn how to treat each other again, and by so doing better serve the people. By learn how to trust each other again, and by so doing, better serve the people who elected us. Stop listening to the bombastic loudmouths on the radio and television and the internet. To hell with them. They don't want anything done for the public good. Our incapacity is their livelihood. Let's trust each other again. Let's return to regular wheels on too many important issues because we keep trying to find a way to win without help from across the aisle. That's an approach that's been employed by both sides. Mandating legislation from the top down without any support from the other side with all the parliamentary maneuvers that requires. We're getting nothing done. All we've really done this year is confirm Neil Gorsuch to the Supreme Court. Our healthcare insurance system is a mess. We all know it. Those who support Obamacare and those who oppose it. Something has to be done. We Republicans have looked for a way to end it and replace it with something else without paying a terrible political price. We haven't found it yet, and I'm not sure we will. All we've managed to do is make more popular a policy that wasn't very popular when we started to try to get rid of it. I voted for the motion to proceed to allow debate to continue and amendments to be offered. I will not vote for the bill as it is today. It's a shell of a bill right now. We all know that. I have changes urged by my state's governor that will have to be included to earn my support for final passage of any bill. I know many of you will have to see the bill changed substantially for you to support it. We've tried to do this by coming up with a proposal behind closed doors in consultation with the administration, then springing it on skeptical members, trying to convince them it's better than nothing, asking us to swallow our doubts and force it past a unified opposition. I don't think that is going to work in the end, and it probably shouldn't. I mean, that is prescient. That is prescient. As a great New Jerseyan, Yogi Berra, said, that feels like deja vu all over again. Do you hear what John McCain was criticizing? One party, behind closed doors, without consultation of experts, against the wishes of Republican governors, is trying to force something through past a united opposition. He literally is describing what's happening right now and condemning both sides of this institution for playing this record over and over and over again. Yes, I'm a Democrat and I admit that our healthcare system needs so much help and so much reform. 1 out of every 3 of our tax dollars is being spent on healthcare. That's ridiculous. And what are we getting from it? A society that's getting more and more sick. And what of our solutions as a body? Did we come together as a team? Did we set up a special conference, set up a special committee to study the issues, to bring in the experts, to involve the best technology, to learn the lessons from private sector and public sector, from universities, from scientists? Are we doing that, or are we doing exactly what John McCain said we shouldn't do, exactly what he described, why he voted no? It is maddening in this country to create greater and greater healthcare crisis, and for us not to solve it, but to battle back and forth between trying to make incremental changes or to tear it all down with no plan to make it better, leaving more Americans suffering what is still one of the most significant ways people go bankrupt, which is not being able to afford their health care. And what are we doing it for this time, John? Senator McCain? I know you wouldn't sanction this. I know you would be screaming. I've seen how angry you can get, John McCain. I've seen you tear people apart on this floor, Democrat and Republican, for doing the same stupid thing over and over again. Listen to John McCain. Explain why he voted no the last time the Republican Party tried to unite and tear down health care with no idea how to fix it and threatening to put millions of Americans in financial crisis and health care crisis. I can't believe we are here again, with thousands upon thousands upon thousands of Americans writing letters, storming into town halls, hospital leaders, private sector leaders, Republican governors, Republican mayors, Democratic governors, Democratic mayors, all saying, what are you doing in Congress? And why? I think what's even more outrageous this time is the why. To redo the tax cuts that independent budget analyses know that the overwhelming benefit went to the billionaires that sat on stage with Donald Trump during his inauguration. We're not saving any money in our budgets. Their plan is to expand our budget crisis. Their plan will add trillions of dollars to our budget and give tax cuts to the wealthiest and not help the people that John McCain is talking about. His echoes haunt me, that he said, we are mistaken when we don't come together across the aisles, across our differences, to try to make things better. There is a healthcare crisis in this country. 1 out of 3 dollars in our government is going to health care, and we have more chronic disease in this nation than we have ever had before, and there's no solution being offered in this reconciliation to deal with that. In fact, we're making it worse because we're denying children access to healthy foods. This is ridiculous. If they're successful, what kind of country will we be? With more stratifications of wealth, with people who have done so good. I'm not one of these Democrats that hate successful or wealthy people. Heck, people in my neighborhood, the only senator that probably lives in a low-income neighborhood, strive to be wealthy. We already know there's fierce competition for the researchers by countries like China. They are aiming, in fact, they are upping their investments in scientific research, doing everything they can to keep scientific researchers in their country. I was just talking to an innovator out in the West Coast who was telling me that they're starting to take passports away from their researchers. There's a fierce competition going on to keep the best minds here in this country or be drawn away to other places from Europe to China, and we're stopping our funding? I've heard from academic institutions that are telling me that they're not even offering as many PhD programs in some of these key areas of science because of the attacks that are happening on our universities, all while China is upping their investments in the universities. I can't believe that they're trying to out-America us, and we're trying to turn our back on our most successful traditions. One of his first actions, President Trump imposed a communications freeze on all U.S. health agencies, effectively silencing some of our nation's top researchers, scientists, and public health experts. This action stalled 16,000 grant applications for around $1.5 billion in NIH funding. The NIH has since begun to incrementally send notices to the Office of the Federal Register to resume reviews. The combination of these actions irresponsibly have stalled our nation's primary source of life-saving biomedical research. It is our understanding that full communications have not been resumed and that it continues to impede critical research at the NIH. As I've been told time and time again by experts in this area, just to pause funding could set research back years. Because when you're conducting research, whether it's in a test tube, in biomedical research, you can't pause. Whether it's in a human body, in biomedical research, you can't pause. Across the nation, brilliant researchers have been finding out daily that the Trump administration has canceled their research. Research on critical issues like maternal health, long COVID, diabetes, new pharmaceutical drugs, cancer, and so much more. The NIH has decided to cancel its 2025 summer internship program. On average, 1,100 interns participate in this program each year, helping develop the next generation of scientists and researchers. A small number of summer interns had already been accepted their offer to join the NIH in 2025. The decision follows the Trump administration's federal hiring freeze. Again, in my faith, there's a saying, train a child in the way he shall go, and he will not depart from it. These are our young people. These are the future scientists now aren't getting the experience of the lifetime. I've met people in this institution who first came here as college summer interns. The NIH has decided not only to cancel those internships, but to shut the door to many kids who had already made their summer plans. Many people here know what it's like to have a summer plan, have a summer internship, not applied for other ones. It's another act of just meanness and cruelty. Let this class come in and then say, okay, I'm going to cut the program next year, but the way they're doing things is mean and cruel and having an impact on people's lives. Congressionally directed medical research programs. I've worked across the aisle with my colleagues. I have friends in here that have worked with me on specific diseases in a bipartisan way. I'm so proud of some of that work. Well, we've long appropriated about $1.5 billion a year in federal funds for medical research, nearly half of which typically goes to cancer. It's something that we have found common ground on in my 12 years here in significant stretches. The medical research program was created and sustained by Congress, competitively awards funds to hundreds of projects each year at both the Defense Department labs and outside research institutions, including at many American universities, to study everything again from cancer to battlefield wounds to suicide prevention. In 2024, $130 million was specifically appropriated in a bipartisan way in this body, incredibly good senators of good conscience coming together and saying we should do more in these areas. They approved $130 million for research in breast, kidney, lung, melanoma, ovarian, pancreatic, prostate, and a handful of very rare cancers. Why? Because they're people of good conscience here. We meet folks who come to this, they're not lobbyists, they come and they tell us about their stories of rare cancers. There are people on both sides of the aisle that have marched for prostate awareness, for breast cancer awareness. There's a goodness and decency here, but in 2024, this funding, it's a bill that passed in March. It was now slashed by 57%. And I told you earlier, that data, one of the best taxpayer dollars we can spend is in medical research. We've all heard this in this body when the NIH has come through and shown $1 invested could get more than $5 back. Any Wall Street executive that would get 5 times their money back from an investment, who is this helping? And do we think about the people? I thank God I don't have many family members that are going about your day, go to the doctor, come back with a cancer. I know lots of people, though. I know their stories. When they're diagnosed with a cancer and they're told there's no cure, I've seen people go through what you go through in that. And so, how could the country that has led humanity for more than a generation or two suddenly have a president come along and say, I'm going to slash all of these things, and oh, by the way, I'm going to give billionaires a big tax cut? So what do we say when these folks come to our office? Some of the people with rare diseases came to my office a couple weeks ago. And the amount of their funding is so small. And maybe if it was to solve our budget deficit, if we're going to do this as a country, we got to come together in a bipartisan way. The debt is I'm one of these Democrats that believes it's a real crisis. But we are not solving the deficit in what they're proposing here. They're cutting and cutting and cutting things that make no sense to cut. And they're doing it for a tax breaks which disproportionately go to the wealthiest and to rack up even more debt. I want to read this article, and my staff told me we have lots of sections to go through, and it's been 4 hours and 11 minutes. But this is one that hurts me because I've met so many people who fall into this category. As you and I and my dear brother, who I've known since he was coming out of college, the 3 of us on this floor at a new day, it's past midnight, a new month, it's past midnight, as we sit here. Why? Because of your question. I can't stand anymore to live in a country where it seems that the convulsions come that threaten our most vulnerable over and over again. I can't stand it. I have to stand up. I have to speak up. We have to do something different yet again. You and I talked about this last week. America, we are not doing a good job right now.
Hey, YouTube fam, if you want to support The Bulwark, the best way to do it is by becoming a YouTube Bulwark Plus member. The Bulwark is truly independent. We have no corporate overlords. We're not settling any dumb lawsuits with Trump. By joining, you help support our work, and you can get a bunch of perks right here on this platform. Ad-free content, bonus videos, live streams, and some emojis of me, which I guess some people want. So come join, come hang out, become a Bulwark YouTube Plus member, and I'll be seeing you in the comments. So behave.